Hey guys, welcome to another edition of Let's Be Blunt with Montel. We're really, really happy to have a very special guest today who suffered a debilitating immune health collapse back in 2012. Now, she credits cannabis for helping to reduce her reliance on harmful pharmaceuticals and for supporting her ability to regain optimal health against all odds. She has a bachelor's degree in nursing from Oregon Health and Science University. She's a registered nurse with a background in acute care, ortho and neuro, and cardiovascular catheter laboratory recovery. It was Janna Champagne. Janna, thank you so much for being here with us today.
Thank you for having me. I'm honored to be here.
Oh, no. Look, I would be remiss if I didn't address the elephant in the room to begin with, and that is, especially when I have a chance to talk to a nurse, but what are your views and takeaways of the recent week when it comes to this COVID-19 pandemic?
Right. I'm trying to look at the positive. I'm an optimist by nature. So I tend to look at the good that's coming from this. You know, we're learning that in our society that we can do things differently and have less impact on our environment. We have a lot of medical professionals that are becoming very disenchanted with our healthcare system. And I think this opens an opportunity for those of us in the cannabis industry to start recruiting some of these medical professionals, not only offering cannabis as an answer for some of the issues they're facing, like anxiety and trauma and potential PTSD, which we know cannabis can help with, but also possible answers for their patients, which, you know, they're constantly looking for ways to better the life of their patients, and pharmaceuticals often fall short there. So I see this as a huge opportunity.
I see it as a huge opportunity also for cannabis, but unfortunately, there isn't a lot of conversation being held on a national basis when it comes to cannabis and this virus. Though every now and then, you know, a comedian will throw out a line or two, but we don't need the comedians to be doing the education. We need people like yourself and other medical professionals that are really stepping up to the plate to help us educate. But let's talk about you're in Oregon, right?
I am correct.
So just like I'm coming into you today from Miami, and we just started opening up some of the things here in Miami on Wednesday, 2 days ago, and as they open, I've been a little disenchanted by the fact that, number one, people don't seem to be listening to the advice of keeping masks on their face, and two, I've seen people literally just doing things that just doesn't seem right to me, like going up and greeting people too close on the street without masks. I've even seen people walk up and still shaking a hand. I mean, come on now. How much more do we have to beat people over the head to get them to understand that life is not, though we want to go back to what we perceive as normal, we don't have to go back to doing things that we thought were normal.
Yes. And that's a good point. And I think that's something we can drive home across the board. You know, people are learning they can do their work from home. We don't have to have gridlock on the freeways. We don't need to be polluting our environment. So I think there's going to be a lot of positive takeaways from this. In Oregon, we just reopened last week, and I'm so excited because the gyms are finally open again. That's my big excitement of the day.
I can't wait for ours to open up. They're not open here in Miami yet.
Oh, really?
I live in a condo complex, and the gym in the condo is not even open.
Oh, I'm so sorry.
I'm going to have to start. I've slacked up in the last couple of weeks just out of boredom, and now I've got to get my butt back in the gear.
Yeah, I think Peloton sales are through the roof with COVID. I think they really benefited from this greatly. So.
Sure. So let's go back and talk about your journey with cannabis and how it started for you. Let's go back to the beginning. Take me back. When did it actually start? In 2012? Were you a recreational or an adult use cannabis user before 2012?
I was. I actually grew up in Sonoma County, California, which is just south of Humboldt. So I knew cannabis as a youngster, as a recreational tool, and never thought of it as medicine until I got sick in 2012. And at the time, I was doing a lot. I used to kind of be an A++ personality. I was working full time in a critical care unit of the hospital, working full time on my master's degree in nursing, and homeschooling my daughter with autism, ignoring all of my body's red flags that something wasn't right, and suffered a major health collapse in 2012. And that it turned out to be immune related, and it flipped into autoimmune. Lupus was one of my diagnoses. And thankfully, I found cannabis about a year and a half into my mainstream treatments. Very unhappy with my progress. I was still disabled, not able to work, bedbound at times. And I turned to cannabis just for pain relief. I have a lot of joint issues and things that go with my condition. And and I knew I didn't want to go down that opioid pathway. As a nurse, you see what happens to patients long-term opioid use. It's not pretty. So I turned to cannabis just for pain relief. And cannabis, in addition to managing my pain, it lifted my brain fog. I was able to think again, which is the opposite of the stigma. It actually reversed my autoimmune markers, which to this day are still negative. And it's just made so many other huge impacts in my own personal health recovery. And today I'm consistently productive and able to maintain a 50-hour-a-week schedule pretty easily. Plus, I still am primary caregiver for my daughter with autism. So it's just made a huge impact in my life.
Now, in 2012, was cannabis a medicinal recognized agent in Oregon back then, or the law hadn't passed at that point, had it?
Yes, yeah, we passed back in the 90s. We had medical cannabis.
Okay, so you ended up having to do what you had to do what a lot of people are trying to do right now, and that's try to figure out how to navigate a space that doesn't have the most qualified people behind the counter selling product. So how did you educate yourself to begin with?
When I started off, I didn't know anything. My husband happened to know a grower, and he went and got some trim from him and made me some good old RSO. That's how I started out. But as we know better, we do better. And nowadays, 8 years later, I'm a nurse, and I've worked with thousands of patients and helped to guide them to optimal products and what research supports specifically for their conditions, and also to find medical quality products, which as you stated, not all products are the same, and the knowledge base of those outside, the medical professionals that are focusing on this really don't have the capacity to do things like check pharmaceuticals for interactions or help to guide medical use for optimal medical outcomes of cannabis therapy. So that's really.
So basically, you just put your head into the books like you do going to nursing school and studied as hard as you could, correct?
Yeah, I'm a total cannabis nerd. Research is what I do as a hobby in my spare time. So that helps.
That's kind of like me, but that's something that, I think we can't seem to emphasize enough to the general public. I mean, I think, some people, when the conversation started becoming more, regular around the country in the last 4 or 5 years, a lot of people just jumped in, ran down to a dispensary, grabbed a bag, and thought, okay, I got some OG this or something or other, and this must be it. But that's not the end of all. And so many people just let that be their end to all.
Right. Yeah, and I always encourage patients that some experimentation may be necessary, even with knowledgeable guidance about which compound, because there's over 140 cannabinoids, over 200 terpenes. There's endless combinations possible to target different specific patients' issues. And that has led me into some work where now I'm actually helping medical quality cannabis companies formulate targeted formulations. So, we have a formulation for pain in the day, pain at night, anxiety, depression, sleep, because we really want patients to be able to find a formula that's meeting their needs.
That also, though, and I know you're a very big proponent of individualized care, but that also brings that into question because one formulation will work well for one person, and another formulation will work well for another person. And you're right. I mean, I think recently I was in a conference and there was a Canadian research group that said that they've now, out of Israel, they're saying that they've identified almost 160 plus cannabinoids now. And
Not
then there's
surprised.
yeah, there's flavonoids, there's terpenes, there's all the things that go into this plant that for years, a lot of people don't even understand that here in the United States of America, we were part of the reason why, in the latter part of the 60s and early part of the 70s, the United States of America in Humboldt County was on a mission to breed CBD out of the plant and attempted to make, lots of clones and sell them all over the place that had high THC content, but were destroying the content of some of the other cannabinoids that are just as important to the overall interaction with your endocannabinoid system.
The criteria I teach my patients for medical quality cannabis is flower derived, and this is specific to CBD. We don't want industrial hemp derived. We want it lab tested, potency and purity. organically grown, and whole plant or whole spectrum. We want the 500 plus compounds we find in that cannabis flower concentrated as nature intended. And research supports that works just as well or better than an isolate or a fractionalized, collaboration of products at 20 to 25% of the dose, which represents huge cost savings for patients. And it also has a more predictable response. So as you're increasing the dose, the effect increases, where with CO2s or isolates, there tends to be a bell curve response where you reach a peak, falls off, and stops working. And so when you think about patients that are taking extremely high dosing for like autoimmune or cancer, they could literally be spending thousands of dollars on product every month and getting little to no benefit. So I don't benefit from the sales of any product, so I'm very objective in my view. I'm, as a patient who happens to be a nurse, I'm a huge patient advocate, and that's my focus. So
One of the things I've found, and I've been in the industry, again, I was literally an advocate in this industry since way back in 2000, long before this became vogue. And, one of the things that I found back then, I am not as much a flower consumer as I am a kief consumer. So I go after pollen, which has really the highest percentage of almost all the cannabinoids and all of the phytonutrients in that. I've been a really, really big kief user now for almost 20 years. And then I started to notice that if you were to take a full spectrum extraction to liquefy and then go back and add additional, okay, you got full spectrum, but now let's go ahead and add, if you want to add for you really want to have a really good sleep response, if you found a really good full spectrum, broad spectrum oil that you can then add and increase the CBN level to, and raise that up and start raising individual terpenes up so that you have the 100%, but now make it an 120 proof, 130 proof with CBD or CBN, and then adding some CBD on top of that. I mean, that's really where we're going to end up getting some fine tuning down the road. But I don't believe that as many of the providers are thinking that way right now. We're still in this mode of, let's see how high we can get you with THC, not knowing that, at some point in time, it doesn't matter what the level of THC is, you are only going to get but so high.
yes, exactly. And it is catching on. I'm working with 3 different suppliers right now. We're formulating, we're doing exactly what you just said. We're taking that whole plant base, looking at the cannabinoid and the terpene profile and saying, where can we amend this to make it a better target for a specific issue? So we're taking that whole plant base and adding CBN for sleep, and adding, CBD for anxiety, and adding THC for, immune suppression for those in autoimmune. And it's really catching on. I'm working with a physician in North Carolina. It's Dr. James Taylor of Integrated Hemp Solutions. And when I started with him a year ago, he had 2 formulations. He had a CO2 and an isolate CBD, hemp, of course, because he's in North Carolina. Now he has 20 different formulations, and 18 of the 20 are medical quality, and they have all different combinations of cannabinoids and terpenes. And we're researching it to see what the patients tell us about their response to these different formulations that we're trying to target.
I think we will end up having to go the path of a pharmaceutical in the sense of doing clinical trials to make sure that, again, we get the response that we're looking for in a broader audience. But we have to know, and we will know, that the response is going to be different in that broad audience. Talk a little bit about your integrated holistic care system.
So, Integrated Holistic Care is an Oregon nonprofit that I launched in 2016 to help educate patients and help them to optimize their medical cannabis therapy outcomes. And of course, here in Oregon, we have both recreational or adult use cannabis, and we also have medical use. So we have both. The patients that call me and pay for an hour consultation are looking for somebody to look at their individual considerations of cannabis therapy, look at their goals for cannabis therapy, and help match them up with the right products and educate. And also, screening pharmaceuticals is a big part of what I do as well, just to make sure that there's, we don't have interactions or combined effects. They know what to expect. And, the result is that many of my thousands of patients have reduced their reliance on pharmaceuticals. They've reduced the side effects of pharmaceuticals, which improves quality of life, improves their function, and overall, they're just doing a lot better. And so, I reach out to a lot of medical professionals through Cannabis Nurses Network. I have accredited programs to educate nurses about cannabis. But I have a lot of physicians that call me and say, what are you doing? I want to hear more about this. My patients' outcomes are just, mind blowing. I don't understand. And so I'm really pushing right now for outreach to other medical professionals to make sure that we're, there's only very few of us doing this work. And so we need more of us doing it.
Are you seeing a lot of pushback though from the traditional pharmaceutical industry of doctors? Or are you getting pushback, or are you getting cautious, reticence, or are you getting cautious intrigue where people are interested? What are you trying to say?
It just depends on where they're at and where we find them. And what I find is that when medical professionals start seeing the patient outcomes, that's often the paradigm shifter. That's often what opens the door a little crack, and then they start researching it and they realize cannabis meets 0 of the 3 criteria for Schedule 1. They realize there's tens of thousands of reputable research studies supporting cannabis for dozens of indications or conditions. It's not as they've been taught. And then they begin to question, like, why aren't we learning endocannabinoid system science in medical school?
Are you not excited about the fact that now that is becoming, I think, a part, at least, I was speaking to a couple of doctors a few weeks ago who were saying that, they did get the 2-hour seminar on the endocannabinoid system finally. Are you excited about the fact that at least they're starting to bring this up, and it should have been bringing this up for the last 30 years?
Oh, really? I know. It's ridiculous. But, it explains why there is skepticism in our medical community, because they don't learn this in school. And they're taught, if you don't learn it in school, stay in your box or you're going to be sued for malpractice. So, I mean, it's understandable that they question the validity of what's being said. I mean, it does sound kind of outrageous. The other thing is, you can't compare cannabis with our current mainstream protocols, with the pharmaceuticals, because pharmaceuticals are 1 or 2 active ingredients where the cannabis plant is over 500. So once you start explaining how it works differently, the system that it activates promotes balance, and the underlying cause of every illness is imbalances. So from a general view, that really explains how it's good for so many things. It's not snake oil. There's real science. These aren't articles out of High Times Magazine. This is NIH research and PubMed research, reputable studies. And so once they see that, if they, helps them walk through that fear, because we've all taken oaths as medical professionals to do what's best for our patients. And so once you realize its safety profile is unsurpassed, the indications it's good for are many, and it really should be the first resort for most patients, in my opinion.
I mean, it's really kind of crazy, the fact that you still have, I speak, often, of course, now during this time, we slowed down a little bit. But I notice it's insane that there's so many medical professionals that don't even understand that the United States government has a patent on CBD, and its patent is based on research that it's funded to identify what the endocannabinoid system is over almost 20 years ago. So it's amazing to me that we just can't seem to get this in our brain that, wait a minute, maybe I've been misled a little bit here.
Yes. And I always say the history of cannabis is a really powerful tool to help open the paradigms of medical professionals, because when you explain that, back in the 1980s, we went to the DEA, we had a federal judge agree with us that cannabis met 0 of the 3 criteria for Schedule 1, recommended descheduling. What did they do? They fired him, brought in somebody else, overturned it. And a couple of years later, our own federal government applied for that patent for cannabis as medicine. Well, 1 of the 3 criteria for Schedule 1 placement is no medical use. So it's like, why are we still fighting this? Why is it still Schedule 1 30 plus years later? And you know what the answer is? Unfortunately, it's politics and money. It's not in the best interest of patients.
And it really had, I think, as we, 20 years from now, we will actually look back and realize how extremely racist this was. And it was put in place to continue to enslave a group of people, because it was something that was used to make sure that you can incarcerate a group of people, thinking that as long as you flooded that neighborhood with that product, then they would have that product in their pocket. So therefore, when I stop them, I can arrest them. And therefore, we can now start making more money in the incarceration business rather than the incarceration for justice. So, I mean, but I think it's going to take another 20 years for people to actually finally let that sink in. But I want to get back to, our discussion. Let's take a few minutes, because I think one of the things that I know the Let's Be Blunt viewers really enjoy is the opportunities that I give them to get some education. And I was really extremely impressed by, reading some of your background and reading into some of the research you've done. And we're going to talk about some of your specialized and individualized care paradigms that you use. Let's take a few minutes to go ahead. You explain, and I try my best. I'm explaining for the last 5 years, the idea, the fact that the endocannabinoid system is real. It is, whether or not we want to call it this or not, it's kind of like a secondary sympathetic nervous system that we've had in our body. All mammals have in their body, going back to the time that we were little rodents on the savannah. And that endocannabinoid system is a system that's attached to our nervous system, one of the only systems in our body that actually sends chemicals retro sends them backwards to respond and let the brain know things are done. When you walk by and you slam your toe into a table, and your toe is getting ready to just go ow, and you're getting to get that huge blast of inflammation, and all those white blood cells are running down to that toe. There's this little signal in our body, it's called anandamide, that actually runs in the reverse all the way back up to the brain to tell the brain, okay, that's enough white blood cells, slow down a little bit, or you're going to destroy all the good material. Nobody knows that that's controlled by and actually modulated by our endocannabinoid. That's an endocannabinoid, but that's modulated by these little nerve receptors that let the brain know, okay, enough's enough. And so it's kind of like the Goldilocks zone, when it's not too hot, it's not too cold, it's just right. That's what keeps us just right. Make sure that our body, you stated itself, kind of works in a homeostatic way, which means in balance. But go ahead and give us your explanation, because I mean, it really, really, really did. It registered well with me when I was just reading the materials.
Yes. And I'm glad you brought up the retrograde signaling. Another big point about that is that the endocannabinoid system is the only system known to act that way, retrograde signaling of our neurological system. And so it's really there to modulate our immune system and that inflammatory response so that it doesn't go haywire and become a big problem. And so the endocannabinoid system, I call it our motherboard. I call it the system that keeps every other system in our body in balance. And, another thing that surprises a lot of people is that we make endocannabinoids in our bodies. And these endocannabinoids act exactly like the cannabinoids from the plant. And anandamide, which you mentioned, is synonymous with THC from the plant. 2-AG in our body is synonymous with CBD from the plant. And so when we can't make enough of these.
Sorry, I was just going to throw it in. We may find out, as we do the real research that we should have been doing, that we may find out that THCV, THCA, and other cannabinoids also actually respond to CB1 and CB2 connectors. So it's like right now, science is just really at what, this is we're at the Wright brothers pushing the wooden airplane down a hill right now when it comes to the research in this field.
Right. And that's a good point. I always tell people, if somebody proclaims to know everything, like back away slowly and maintain eye contact, because they're going to be obsolete very quickly. You need to keep open mind to new information. And that's one of the reasons, this is such a great match for me. I have hungry brain syndrome. I'm constantly liking to learn. And so this is a very exciting industry for me. So the endocannabinoid system, it's actually said that the endocannabinoid system is vital for life, that if we don't have an endocannabinoid system, life is not possible. And the other thing I really like to drive home is the importance of endocannabinoids and cannabinoids as vital nutrients. The most prolific source of endocannabinoids that we make is in breast milk, which we know is like the milk of life, right? And so just knowing.
Not cow's milk, breast milk. Let's make sure people
Breast milk from humans. We make endocannabinoids, we give it to our babies in our milk. So that's how important it is. That's how vital it is as a nutrient. And when your body can't make enough of those endocannabinoids, that has been coined as a condition itself called endocannabinoid deficiency. And that is said to be underlying in every person that has chronic illness, according to Dr. Ethan Russo. So, I mean, when you start putting these pieces together.
Yeah, you take a look. You take a look at. I'm not didn't mean to cut you off, but I'm throwing this out there for our viewers again. You take a look at the fact that it's been now 100 years that we have outlawed the consumption of cannabinoids. And we go back before that 100 years, people ate a hemp-based porridge in the morning for breakfast. As a matter of fact, back as far back as 1590s. As a matter of fact, coming across on ships going across the ocean, they ate a porridge of hemp because we knew that hemp was one of the highest protein-laden seeds on the planet. They didn't recognize all of its effect on the endocannabinoid system, but it was what was keeping us in balance back in a time when, we didn't have air conditioning, we didn't have heaters, we were sleeping on the ground, we were getting, inundated with all kinds of bacteria and things like that. That's what helped to keep our immune system as balanced and as strong as it was to help us survive. It wasn't until you hit the, early 1900s, really late 1800s and early 1900s when we start to see some of the maladies and diseases that we've seen now that are so rife within our society.
Yes, yes. And unfortunately, cannabis was made not illegal, but it was taxed so high that nobody could afford it in 1937. And like you talked about the racism behind that, they changed the name from cannabis, which all the doctors knew it as, to marijuana to increase the stigma of Mexican Americans. And the doctors had no idea they were outlawing cannabis. They thought it was some other plant. But unfortunately, cannabis and hemp is a competitor for so many big industries, from paper to textiles and cotton to, I mean, hemp steel, not to mention medicine and food. And so the basis behind that was really financial. It had nothing to do with the benefit of the people. And when that happened is when we had this explosion of chronic illness in our population we'd never seen before.
And it continues on until today, and especially where the fact that the longer we get away from using, cannabinoids and actually balancing our system, we see that what we call autoimmune diseases may truly just be, as you said, endocannabinoid deficiency disease that has really thrown the rest of our system out of balance. And I've been a person who was diagnosed with MS now almost 30 years ago. And still, well, I should have been diagnosed almost 40 years ago. I was officially diagnosed in 2000. So it's 2020, so 20 years later. But I have been a daily cannabis user every day since right before the diagnosis and after. And I think that's been part of the reason for my success with this illness. I've done really, really well, but it's because I've gone, and there were some times and periods of time when I was really feeling some of the pains of my disease in an extreme way, that my usage of cannabis was really, really extremely high. But then as my disease has gone on its way, my usage of the cannabis has gone on a wave, but I continue to use every day. I put I put at least CBD in my product in my body every single day of the week.
Yes, yes, I do too. I do too. I have multiple forms: CBD, CBG, THCA in the morning, THC, CBN, THCA at night. And I just so admire that you've been so open about your story. I know, just even having been in this industry 5 years, it's difficult sometimes to talk about. So the fact that you've been such a pioneer and been so open about your story, I think, how many doors has that opened? I just really admire your willingness to put yourself out there and tell your story. Fantastic, by the way. So you're doing something right.
No, same for you. I mean, if we're not willing to share what we learn for ourselves with others, what value are we on this planet? And unfortunately, that's what we're seeing going on right now. At least right now, through this COVID thing, there are more scientists willing to share as much data as they can because they recognize its value to the masses. So yeah, let's talk a little bit about your whole individualized patient plan. People reach out to you for individualized plans. Talk a little bit about how that came about.
Well, I began teaching. Well, actually, my start in this industry back in 2014 was as a grower. I was still fairly disabled. Growing actually got me back into physical shape. I was so sick. I'm 5'8" and I was down to 113 pounds. I was size 0, just wasting away basically. And once I started feeling better with the cannabis, I started growing my own medicine because it was more affordable and I still wasn't working. And then I began growing for other patients and realizing that different strains were good for different indications and different patient goals. And that led into making products, making concentrates and tinctures and edibles and topicals and whatever the patient wanted. And so that really led to me beginning to educate patients about cannabis and its use and how to optimize it and how to target it for their conditions. And so then I began consulting, and patients would call me, and I do a pretty intensive assessment of their needs through an intake form, and then I spend an hour with them on the phone and just assess their situation, assess their goals, educate them, answer any questions they might have, make sure they understand the goals and what's reasonable to expect from the cannabis therapy. And so that has grown now. I actually have hired and trained 3 more nurses, and we work with patients all over the world. So that really took off. Just so your audience is aware, I'm not currently taking new patients. The state of Oregon is actually trying to restrict nurses' ability to do this. So I'm involved in that fight right now through Oregon Cannabis Clinicians Group, and Dr. Rachel Knox is heading that up. She's just a powerhouse.
How did this start? Why did all of a sudden the state of Oregon start pushing back?
Oh my gosh, I don't know. I to be honest, I kind of suspect that one of the board members is receiving some pharmaceutical in some money or some incentives to do this, because cannabis has been legal here medically for more than 20 years. It's always been a gray area, covered under patient education under my nursing licensure, which is still current and valid. And then last November, they decided to reject the NCSBN guidelines, which is the National State Board of Nursing guidelines for nurses in the cannabis industry, which I have followed to the letter for years. And they decided to reject them because there's a law in Oregon that specifies that patients must be educated by physicians. And so we're working to change and expand that law language. So that's what's happening. But in the interim, unfortunately, patients are at heightened risk of not being successful with their cannabis therapy, because they walk into a dispensary and choose from thousands of products, and the education of the bud tender behind the counter, may or may not be where it should be. I mean, they certainly can't do things like look at your pharmaceutical list and tell you what to space. And the physicians here are, for the most part, are not educating. The patient goes to their doctor appointment for a cannabis and they walk away with a signature, which is not a prescription. It doesn't tell them what to buy, doesn't tell them how often to take it, what route, none of that. So we were really filling an important gap here, and now we've had our hands tied, unfortunately.
And you're not allowed to then interact, or you can still interact with the patients that you've had to date, correct? Or no?
Yes, I can. Yeah. I do. I still do follow up with, and it's mostly, I don't charge for it anymore because I don't want my nursing license to be impacted, but that's okay. I'm paying it forward.
Sure. I guess freedom of speech gives you the right to have a discussion with anybody about anything you want to talk about.
Yes. It's very specific about guiding them towards products to help them with specific conditions is where my hands are tied. And I am allowed to teach about hemp and CBD. So thankfully I've got a couple of contracts with CBD companies that have kept me afloat. So
okay. So you're allowed to talk about hemp, but you can't talk about cannabis.
Exactly.
Which is really ridiculous.
Yeah. Well, and in Oregon, nurses can administer THC cannabis in certain situations, but we can't talk to the patient about it. I mean,
it makes absolutely zero sense. Talk a little bit about now. You've got what's called genetically guided cannabis therapy. Let's explain what that is.
So another area that I specialize is Nutrigenomics. And this came about because, of course, I have a daughter with autism and there's some genetic predisposition there. So I began actually researching that before I got sick in 2008 was my first epigenetic conference. And in learning about the power of manipulating gene expression, because you think of genetics as this static thing that doesn't change, but actually it has like an on and off switch on the gene. And we know that with environmental impact, meaning your lifestyle, your diet, your stress management, you can actually turn on and off genes that you could like turn off a gene for heart disease. And even if you have that genetic predisposition, it's in your family, it may help you prevent ever getting heart disease. And so it's just as fascinating. There's tons of research out of University of Berkeley on this subject. And, I think the first article that caught my eye was one called DNA is Not Destiny. And it's this research study about a mother rat. And they found that just by changing her diet, they could change the color of her offspring. So it's huge. It's huge. And so I specialize, and Nutrigenomics was really integral in my own recovery. It's been integral in my daughter's improvement of autism. And so now we've learned the genetics of the endocannabinoid system and how they cross over with the immune system and the neurotransmitters and the gut, and all these different huge areas in the body, and how we can optimize some of the underlying contributors to the imbalances. And so I know it's complicated, but I use this analogy of overflowing sink for illness. You've got imbalances, they built up, they're everywhere, it's a big mess. Starting cannabis can be likened to taking the plug out of the drain. You're going to start getting your body to promote balance, targeting the genetic contributors to those imbalances through nutrigenomics, turning off those light switches. It's like slowing down or shutting off the faucet. The combination of the two is how I'm healthy today. At that and say, okay, so this form of cannabis might not be good for you. This one might be better. So we're starting to use it in that capacity as well.
Wow. Okay. Well, you've had success with your own daughter. You just mentioned her, and the fact that she has been on the spectrum, and she's an autistic child who started to act out differently when she hit the puberty mark. Is that correct? And a lot of families with autistic children go through this. Why don't you take us on your journey? Just talk about what you did and how you navigated that space.
Well, it was a couple of years into my illness journey, and I had found cannabis and found it to be very effective and very safe. Had never thought of it for my daughter. She was diagnosed with autism at age 2.5. She was nonverbal until age 10. She was considered severe. She was labeled mentally retarded at age 7, unable to learn. And as I was coming out of my haze of illness, she entered a puberty crisis where she went from being this sweet, loving, cuddly little girl, very eager to please, to the hormone monster. And she was actually diagnosed PMDD thereafter, which is kind of like homicidal PMS. And she was beating up all of her caregivers, anybody of authority in her life. She destroyed my home, holes in every wall, holes through every door. She was self-injurious on top of it, which almost led to out-of-home placement um, because of the safety issues that brought in, and a lot of trauma, of course, in the midst of all of this. And so we started her on THCA. We got her a cannabis card, everything legitimate, doctor oversight, and it resolved her severe behaviors that were risking out-of-home placement. It spared her that. It spared all of us that. So this has added to my passion, and I'm kind of known as the autism cannabis nurse for that reason. Her story actually published on the cover of Everything Medical Marijuana magazine in 2017, which sold in Barnes and Noble across the country. And that was kind of my coming out of the cannabis closet as a holistic. I was calling myself a holistic nurse before that, and after that, I'm like, okay, I'm a cannabis nurse now. It's been a journey. It's been, and I feel so blessed now to be able to utilize this knowledge that we learned through those traumatic experiences to help other patients, because that really gives it all purpose, which we know is key for post-traumatic growth. So I feel so.
It's anecdotal, but at the same time, I want you to talk a little bit about your daughter's journey. Now, how did you introduce her to cannabis? Was it edibly? Did you smell it? Because a lot of people, when they hear cannabis and kids, they think that, mom and pop sit down on the couch and pass a joint over. That's not what's going on.
Right. Not at all. And as I explained in my article, which you can find on my website, Integrated Holistic Care, under the news tab.
Say that again slow. Say it again real slow so people get it.
IntegratedHolisticCare.com under the news tab is my daughter's story. And what I explained is that, of course, with my daughter, we started with a non-intoxicating THCA in acid form because I was concerned about the neurodevelopmental issues that research supports are possible with THC use in childhood or adolescence. And I talk to every patient, that's calling for a minor about this. And we're always weighing the risk versus the benefit. Well, in my daughter's case, she did end up progressing to THC and CBD and CBN and CBG and a bunch of other forms. And we've got her protocol pretty well dialed in at this point. And I just have to.
How old is she now?
Just turned 18 last month. I can't believe it. So yeah, I'll be an empty nester soon. I actually have plans to convert my home here once this whole COVID thing clears, because that's held everything up. But this will be an autism cannabis care home at some point in the future once we're able to do that. Bring in a couple of roommates, and that'll be an integration along with optimizing other areas of their quality of life and function, like I've done for my daughters. Very exciting. But autism is endocannabinoid deficiency at its root. And if you look historically, we took cannabis off the market in 37. The first case of autism showed up early in the 1940s. We know that endocannabinoid genetic mutations predispose autism. We know that autism is correlated with anandamide deficiency. I mean, there's so much research supporting this. And so I almost think that if we hadn't stopped using cannabis so prolifically in our society, autism might not even exist today. That's how strongly I feel about it.
Wow. Now, and again, but that journey that you took your daughter on, you used various methods to titrate her initially, right? You were using edibles, using other. Talk a little bit about
I tend to really like the tinctures. They're
that.
very they're just so flexible. You can use them sublingually. You can drop them in a capsule, swallow them. You can put them in food, put them in drinks, and you can also titrate really slowly. You know, with the concentrates or the edibles, you don't. Edibles are tricky because you're putting the concentrate into the recipe, and if you don't mix it correctly, you get an area of the brownies that are really strong, an area that are really weak. So I don't tend to go with edibles as much for people, but it's really just based on what the patient wants. And I like the tinctures because you can start off slow, count the number of drops, know exactly how much you're taking, increase a little more sublingually if you want more effect, figure out your sweet spot. And, you know, I always tell patients the goal is to find where you're taking the cannabis 2 or 3 times a day. You have good baseline symptom management. But it's flexible. If you have a day that's harder, take more. It's not going to hurt anything. Just make sure you're spacing around those pharmaceuticals correctly.
Great. And now you do you still work with parents of children who are on a spectrum?
I do. In fact, there's an autism recovery summit that I'm part of that's launching next weekend on the 29th. And that's with Luminara Sardana. So you can look that up. I also have several other autism outlets going on right now where I'm just openly trying to educate parents about this option so they understand, because the puberty crisis is common to 50% of kids with autism, and it's such a huge answer for that. But even earlier on, we find that if we can get the cannabis into these kids when they're younger, it seems to bring even better benefits as they get old and they age.
And now your daughter will be on a regimen for as long as you can see, correct?
Oh, lifelong, yes. She has endocannabinoid deficiency. She needs cannabinoids from the plant as a vital nutrient to supplement what she's deficient in.
I can't think enough. What's coming up for you in the near future?
Oh gosh, it's kind of unknown. You know, I'm doing a lot of medical professional education. I have an opportunity right now to come on to faculty of a college that's putting together some programs. I'm doing a lot of consulting and research with physicians and different groups. I have 2 research studies on COVID going on right now, specific to cannabis and its capacity to help reduce not only as a preventative, but potentially reduce the cytokine storm in those who have active COVID. So I'm taking what comes basically.
I've been hesitant to start the conversation about the fact that cannabis would probably be a good protocol for especially those who have overcome COVID bad symptoms and are in their recovery phase. And it doesn't have to be again smoke. So a lot of people are thinking about, because this is an inflammatory disease of the lungs. Of course, you wouldn't be asking people to go ahead and now vaporize things or put things down in the lungs. But then again, from a analgesic standpoint, from edible standpoint, and anti-inflammatory standpoint, I can't see why it would not be of some value.
Yeah, absolutely. And there's a couple of, I'm looking at the genetics of COVID too, and there's a couple of pathways that CBD inhibits that trigger the cytokine storm in COVID and trigger the fibrosis of the lungs in COVID. And so if CBD can inhibit that, it's going to reduce the amount of damage in those that have been diagnosed with COVID, not to mention that it can be preventative.
I think that we've known this since around 1998, when back. But then when I think there was a study that was done by McCaffrey, it was either 98 or 2000, that talked about cannabis and cannabinoids and their protective mechanism inside the lungs rather than a damaging. And so there may be research that's 20 years old that substantiates that.
Absolutely. Absolutely. And, lung cancer is not attributed with cannabis inhalation. Inhalation for me is not usually the preferred method for medicine, but it does have, some really great uses. And like my daughter, we've taught her how to use a vape pen because if she's ramping up and she's showing signs that she's headed towards a big behavior and the sublinguals take 10-15 minutes to kick in for her, where the vape pen is 10 seconds. And so
Right.
stop those behaviors in her track and stop before she has a meltdown. And so it's a really great tool that way. And, it's great for quick symptom management. We know it's not harmful for most. So it's always a tool. But I always say if you're inhaling, always be taking it orally as well. That way you're getting it into the rest of your system.
Yeah, it's going mucosally, correct, especially in the vapor.
But smoking is great for quick symptom management.
Absolutely. Janna, I tell you, I cannot thank you enough for having joined us today. I'd love to have you back in the future.
Yes, anytime, please.
And I know that all of you out there who tuned in to Let's Be Raw Montel today are going to be absolutely thrilled with the conversation we just had with Janna Champagne. Again, give out your website if somebody wants to go and get some more information.
Yes. So the best place to find me right now is actually my media kit website, which is jannachampagne.com, Janna, champagne like the drink.com. And that kind of gives an overview of all of my roles in the industry. If you're a patient and you're looking for help, you can reach out to me either there or on integratedholisticare.com. And while I'm not practicing currently, I do have other nurses where I can refer patients to.
Super. So make sure you go and write that information down if you need some help or need to just, pick a brain. Go on up and do so. And I can't thank you enough for having joined us today on Let's Be Blunt with Montel.